during the last 3 years, we have seen the worst public health mistakes in history. Very early on in the pandemic, it was clear from the data from Wuhan, China, that there is a 1,000-fold difference in risk by age. So older people, while anybody can get infected, older people have more than a 1,000-fold risk of dying from COVID compared to young people. There were two major failures or categories of failures during the pandemic. One was the failure to properly and optimally protect older Americans, those who are at high risk from dying from COVID. For example, we didn't protect nursing home residents properly. And it's not just by sending sick people to nursing home, which of course was criminal, but also we have too much staff rotation in nursing homes. We didn't do enough testing of nursing home staff to prevent infections to come in. We also didn't protect older working age Americans in the 60s and 70s, while the laptop class was often working from home, whether they were in the 20s or 30s or 40s. Many older working class Americans in the 60s and some in the 70s were still working as cab drivers in supermarkets and so forth, being infected. And in fact, the way we dealt with the pandemic was the worst assault on poor people, working Americans and middle-class Americans since segregation and the Vietnam War. When, as part of the Great Barrington Declaration, together with Dr. Bhattacharya here and Dr. Snehata Gupta at Oxford University, when we proposed very concrete things for how to better protect older Americans who needed better protections, we were instead slandered by claiming that, for example, we advocated by wrongly stating that we advocated a herd immunity strategy. We have very concrete proposals for how to better protect older Americans, but that was dismissed and we were slandered instead of taken seriously. Secondly, lockdown harms, school closures, people not going to medical visits and so on, that has killed many Americans and will continue to do so in the next few years. For example, a woman who didn't get her cervical cancer screening in 2020 might now die next year or 2 years from now instead of living another 15, 20 years. So the lockdowns had enormously negative consequences on public health, on not only cancer screening and treatment, on cardiovascular disease treatments, diabetes care, vaccination rates for children plummeted. Vaccination is very important to vaccinate our young children. Also, of course, as was mentioned earlier, the mental health, both of the young people and older adults. So that was a major failure of our pandemic response. These failures are due to abandonment of basic principles of public health, and I mentioned two of them. One is that you cannot only focus on one disease, in this case COVID. You have to look at public health generally, all diseases, including chronic diseases, including mental health. We didn't do that. All the focus was on trying to suppress or eradicate COVID, which was impossible for a disease like COVID. The other thing, we were thinking short-term instead of long-term. Yes, you can do lockdowns and reduce short-term infections of COVID, but that has long-term consequences in, for example, cancer and cardiovascular disease. That was not considered. So there was never done a proper benefit risk or benefit harms analysis. Mistakes were made, and the pandemic response is a house of cards that's now falling apart one by one. I don't think that anybody left who thinks that school closures were a good idea. There is now being recognition that there is immunity after having had an infection. So there was never a reason to mandate vaccine for people who had already had COVID. There was recently a study of masks that shows that masks have zero or very limited benefit. So this house of cards is now falling apart. And we have a choice. We can either double down on those mistakes and pretend that they were not mistakes, or bury it in the sand, or we can have an honest evaluation of our response And it's encouraging to hear from the opening statements of the chair and the ranking member that your intention is to have a very honest evaluation of our pandemic response. And I thank you both and the rest of your members for that. Thank you very much.